coronavirus is coming. Hi, I'm Maddie Luna and I wanted to welcome you back to my channel and also give you a huge thanks for clicking on this video. In this video, I wanted to talk about my experience with COVID-19 as a new nurse. I wanted to share my thoughts, my feelings, and also what my hospital is currently doing during this whole pandemic. So first things first, I just want to let y'all know right off the bat that I am not currently taking care of any patients with COVID-19, nor have I taken care of any in the past. So since this whole pandemic thing started, I have not yet had contact with any of these patients. You know, I have been hearing conflicting information from the leaders within my hospital. Some have said that there are COVID-19 patients on in my hospital, and then others have said that there isn't. So I'm not really sure what exactly is the truth, but I think that if anything, our unit would be maybe like one of the last units that COVID-19 patients would be sent to, just because it is a cardiovascular intermediate care unit. So it is a higher level of acuity. The patients that we have tend to have a lot of heart conditions like heart failure. A lot of them have heart procedures like open heart surgery or heart caths, all these things. And you know, having other comorbidities along with COVID-19 is basically just, it's gonna be a disaster, and it's gonna be even worse for the patient. So I don't really think that they would risk our heart patients by putting them together with COVID-19 patients, but at the same time, I don't really know what's going to happen. So at this point, I'm just kind of like, oh my God, I just don't know. I think that this is all very scary because I'm a new nurse. I graduated in May of 2019. And I actually started working on the floor by myself in October of 2019. So, you know, I've only been on the floor for November, December, January, February, March, 5 months. It's about to be 6 months on April the 19th, I believe. So I haven't even been a nurse for like a whole year. And, you know, I'm having to, I guess, possibly take care of these patients that, I mean, we're going through a pandemic, and as a new nurse with less than 1 year experience, I feel really inadequate. You know, I'm still barely learning like how to take care of our own patients that I'm used to seeing since I first started, and just the thought that I'm going to have to take care of you know, these really sick patients is it's really scary. It really is very scary. You know, if I had to, I guess, use one word to I guess explain or portray what you know, this whole pandemic thing for me, it would be uncertainty. And the reason why I think that word really pretty much sums up this whole experience for me is because you really don't know what's going to happen one day to the other. Like, I do like 3 days working in a row and then I'm off for 4. And it's kind of like I'm off for like all these days. When I go back to work, I really don't know what's gonna happen. Like, I really don't know what to expect. And even then, like, one day to the other, things change so much. Like, I think it was like last week where, you know, they kept like, they'll send us emails like every day, or like they'll come talk to us, or there's just like nursing leaders like rounding and stuff, and it's like, you already, like, we know that they're like scoping out the unit, trying to basically see, like, I guess I guess just trying to come up with a plan if, you know, we do start getting all these, you know, COVID-19 patients. So changes are coming, and changes are coming like every single day. So that's another reason why I feel like uncertainty is a really good word to describe what's going on right now. Also, it sucks because I feel like just having so much uncertainty really builds a lot of anxiety and stress for me. Like on a normal daily shift, I already feel anxious and stressed out. So I feel, oh my God, even now I'm anxious. It's more anxiety and more stress. I think it's like also really scary because every hospital is usually like crazy, you know, like on a normal day without a pandemic, hospitals tend to be very busy. You know, you're basically always full to the brim with patients. Whenever you discharge a patient, another patient comes in really fast, you know, so like you really just, you don't have a breather or anything. It's like patient in, patient out, patient in, patient out, patient out, patient in, patient out, patient in. It's kind of very eerie because I feel like for like the whole maybe last month, the floor has just been very quiet, very still. We have maybe like 13 patients out of like I think a 25 room unit. So it's just really weird. It's eerie, and it really makes us feel like it's the calm before the storm, and the storm is coming, like, and it's coming full force, you know. Things are just so different. Patients' families aren't being allowed to come up to the unit, or like they're not allowed to come into the hospital basically. This gives us a lot more responsibility as well, because, you know, we are expected to be calling the patients' families and giving updates on all of our patients. And you know, a lot of times our patients' families are there and they provide a lot of like help, you know, and when they're not around, it's like we literally have to do absolutely everything for these patients. It does make it a little bit harder and a little bit more stressful. It's definitely different at work. It's not that it's harder and it's not that it's easier, it's just different. I'm not used to that. I don't think any of us are used to that actually. And I really feel like it's because the worst is coming. It's kind of reminds me of like Game of Thrones when they're like, winter is coming. You know, like coronavirus is coming. Like literally that's how it feels like. It's like brace yourself because the craziness is going to come. So one of the things that was making me really uneasy about this whole situation is because I keep hearing from like other people or like social media and stuff that hospitals don't have enough you know, personal protective equipment, PPE. And I mean, it makes me uneasy because obviously, like, I mean, am I going to be protected whenever when the time comes and I'm exposed to, you know, the virus? And so I've been stressing out about that as well. But my hospital actually did something that I'm very proud of. If, you know, as an employee you are to get infected with the virus, regardless of where, you know, outside of work or in the hospital while taking care of a corona patient, you will still be paid for the 14-day period, which, you know, to me is, I mean, that's amazing because it really makes me feel like, you know, they do care about us, you know, they are taking us into consideration. They're also offering, like, I think either like scrubs, like for you to work in, or like a laundering service in-house. So like in the hospital they're offering for our scrubs to be washed so that we don't have to, you know, go home and take, you know, all the bacteria and stuff to our families, which is another huge deal for me. And then the last thing that I was really proud of is that they're actually finishing up the details with hotels, with different hotels, so that they're able to provide us rooms for, you know, the employees that are taking care of corona patients and don't want to go home and you know, give the virus basically to their family. So that really does make me feel a little better about the situation. Real big thanks to my hospital for taking care of us in that way. As a nurse, I really do want to ask you guys to please take this situation seriously. I've seen posts on Facebook and such about, you know, from people still doubting that this thing is actually real. You know, they're kind of like, oh well, I don't know anybody with the virus, therefore it must be fake. Like, I personally don't know anybody with the virus, but I do know that it is real. So please, people, please stay at home, wash your hands, take as many precautions as you can. This is not a joke. This is really seriously killing a lot of people, and regardless if this whole virus was like man-made or not, and you know, all these conspiracies and stuff that people are like, you know, talking about, it doesn't matter. The fact, it doesn't change the fact that people are dying from the virus. So please do your part. You have power to do your part and to help. That's basically all I have to say about the situation. Thank you so much for tuning into my channel. You know the deal. Go ahead, like my video, leave a comment down below if you have any questions about, you know, the whole coronavirus. Let me know and I'll try my best to give you an answer or to find an answer out for you. So anyways, thank you so much again. Bye.